People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened?
You all right?
I love my wife.
Any reception can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
I think it's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Got hurted. On my thumb, and you kissed it. That's me.
Any reception can I help her?
Should I help her? See what she said? Any reception going to help her?
When did he ever come to A&E?
She said, didn't she?
Please kiss. Let Nanny kiss it. No, on the... That's magic. Whose is more magical, Nanny's or Mummy's?
Both of yours.
What?
Both of yours.
Oi, remember who buys you things. Oh, I'm gonna have a bacon roll this morning. I am, when the others coming in. Oh my gosh. Do you want one? I'm kind of the person at work that is always being silly.
I think your poppers all the way down. Oh, that's dangerous. I got zips. Zip, 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 yeah.
You can't take yourself too seriously, can you? Exactly.
Is this your phone ring? We're just having a little dance.
The other nurse practitioners that I work with, I absolutely love them. They're amazing. They're such a funny bunch. It's nice to have people that close to you, who will take you through the thick and the thin. So just pop this one underneath the tongue. Thank you. Oh, not working. Run out of battery. It's all going right today, isn't it? I'm definitely not smiling and happy all the time. So, yeah, it's important to have people around you who are going to support you.
I enjoy resus more than anywhere else in the department. The phone doesn't go through you. It's so loud and it's shrilly. It used to make me jump. I think the first 6 months of working in there, I wouldn't even answer it. You've only got to miss out a small detail, you know. Is it male or female? Didn't ask. How long? Not sure. Now I'm fine. It's just the phone going off and just get to it as quickly as possible. St George's Resus. OK. It's trauma. OK. So it's adult trauma, male or female? Male. That's all right, don't worry. Okay. Bye-bye. Adult trauma call, resus, ETA 15 minutes.
A 38-year-old man is being brought to St George's after falling from a tree.
Elder, can we have a radiographer to resus base 7 for the trauma call, please? 38-year-old, fall 25 feet.
Dr. Mike Williamson is part of the trauma team in resus today.
When someone falls, you're worried about the head, and then you're worried about spinal injuries.
The family are travelling to St George's from their home in Surrey.
Approximately an hour and 45 minutes ago now. He's a tree surgeon who was wearing a harness, but the harness has somehow failed, and he's fallen 25 feet from the top of the ladder. He's hit his head on the concrete, just as he was on the concrete pole, just as he was landing. He's been spinally immobilised, pelvic splintered.
OK, Shunid, you happy with airway?
Okay.
Let's get him off the scoop first.
Airway patent, C-spine immobilised.
What's that blood from? Is that from his head wound?
From the head wound, quite a significant amount.
Okay. Everybody ready?
Can we get a chest X-ray, please? We've all got leads on, so carry on.
So, Paul, any pain there when I'm pressing?
No.
Any pain there when I'm pressing?
Where's the pain, Paul?
Started like middle of my back and that went down.
OK. Any pain in that leg there?
Collar. Put him on the monitor, please.
Pins and needles. He's got pain to his bottom, pins and needles. When the patient comes in, if they're complaining of pins and needles, my heart always sinks.
I'm just going to do an ultrasound of your tummy, so you feel some cold jelly, OK?
It could be a sign that there is trauma to the spinal cord, which can cause paralysis. Paul, can you feel me touching you there?
Yeah.
Can you feel me touching you there?
Yeah.
Is there anything on the fast scan?
There might be something behind the bladder. I thought I saw a little slither behind the bladder, but the other sides are OK. Do you want some more painkillers, Paul?
I keep getting like shooting pains going right down to my bum.
I've just spoken to your wife and your kids. Yeah, they're here. We'll get them over.
I was just waiting for my internet shopping to be delivered, and I got the phone call from his labourer to say that he'd had a fall. I thought maybe the ambulance had been called just as a precaution. But when I realised he was being taken to a special hospital, he was being taken to St George's and not a local hospital, I thought, oh, this is a little bit more serious than I thought it was.
Paul, we're going to take you to the scanner, OK? We'll do you head to pelvis, so we'll scan, so we'll get an answer to what's going on straight away.
Some painkiller.
Of course, we'll get you some painkillers, no problems.
You think so many things go through your head. You're thinking, what if he doesn't walk again? What's going to happen? Not just to us as a family, but also to his self-esteem, how he's going to feel.
Mike, can you speak to CT?
Yeah.
Thanks. We think that he might have a pelvic fracture.
Yeah, OK.
Tree surgeon Paul is being taken to CT after falling 25 feet at work.
Let's just go for the scanner.
That's the only thing you're allergic to.
He's not the sort of person that's ever wanted to sit behind a desk and push paper. He's active.
right, does it? Let's come off somewhere. Is that a fracture there?
I think because you're up there on your own with your chainsaw and you're sort of above everybody else, and it's probably quite a nice feeling, like a free feeling. Yeah, I didn't mind.
Yeah.
Look at that.
That's where he's painful then.
He's got a fracture, does he? Oh, one, you said.
Yeah.
Oh, yeah.
Yes, that's not very nice.
You've got some little pieces.
Hi, Paul. One of your spinal bones, just at the bottom, looks to be broken. It is broken.
What's that mean?
So, at the moment, we'll speak to the neurosurgeons about that.
Okay.
And we'll see what they say. But I'm just going to take this binder off, OK?
CT results show 38-year-old Paul has broken a vertebrae in his back. Doctors are concerned fragments of the bone could damage his spinal cord, risking paralysis.
Your wife's here, but just wait for the doctor to finish and I'll let her in for you.
So you fell from quite a height.
Yeah,
but
it said 20 foot.
Yeah, or 25 foot, they told us. So the radiologists are now looking through the scans. So from first look, it's a fracture of one of the bones in the back, in the spine. It's not so much the break of the spine that we get worried about, it's what's happening to the spinal cord. We'll re-examine him and let the neurosurgeons know. My hunch is they'll want to take him to theatre.
You do go very numb. I told my daughter that Daddy's fallen from the tree and he's bumped his bottom, because obviously I didn't want to tell her quite what had happened, because I didn't want to scare her. When we did eventually go and see him, it was quite scary, seeing him like that. Hey, Sojo.
Oh.
Jesus Christ, what happened?
I don't know what happened. They just went. I've never had pain like that in my life. It's still, I broke the bottom of my spine.
No more trees, huh? We met at school, probably about 20 years ago. We went out for a little bit and we split up, and I didn't see him for years and years and years. Got with someone else, and then I split up with them, moved here, and somebody up the road there knew him and said, "Oh, he's been asking about you," and then we got back together again. So that's been 11 years now. There was always children there when we got back together, because he had a son and I had two. It was really hard. It put a bit of a strain, I must admit. There was times where I could have said that's enough. Then Abby came along, and I think it just brought everybody, it gelled everybody together.
You can pop in and see him if you want to.
I love you. Abigail's here. No. She's not getting any lighter.
Oh.
Sorry, did I knock you? Okay, Ab. Yeah? Daddy's been in the wars, hasn't he? Yeah? Would you like to go and wait with Pilch? Yeah? Can you take her out to Pilch?
Are you all right?
I think she's a bit upset.
Oh.
That wasn't probably the best idea, was it?
What?
She's crying.
OK, let's see. Let's see if I can find a stash of biscuits. Come on, then. For children, it's hard. It's very upsetting for them. They don't understand. All they can see is Daddy or Mummy's hurt. So that was your favourite? He's pretty hectic, pretty chaotic, so to a child it can be confusing. So this is a hospital. This is the Majors. This is Terry. Say hello, Terry. Hi, Terry. Say hello to my little friend. My Daddy's not very well. She got a bit upset, so we're going to find chocolate biscuits.
Cold?
Yeah.
Do we shut the door?
I'm a bit nippy, yeah. I'd appreciate that.
Do we shut the door? Are you cold? No, you're hot, aren't you?
Cold.
Who's hot? You're cold.
I'm room temperature.
I'd rather be cold and warm myself up than be hot and try to cool down. That's the worst.
No, I prefer to be hot.
I think I've probably seen it all. I've been doing A&E nursing for 12 years now, and well, I don't know. Have you ever seen it? I suppose you've never seen it all, but I think I've seen enough.
yeah.
Mr. Mirza.
Yeah.
Switch hands.
You are very nicely.
Oh, thank you very much.
Yeah, very.
Have a little feel. So it's just in this bit here, isn't it?
Yeah.
Just here.
Yeah.
How are you down here? Is that okay? Some people might argue that my job's not quite as exciting as general A&E nurse's job. Mainly I deal with kind of like the minor side of things, the minor injuries, minor illness. But I quite like seeing a patient come in. You can kind of do their treatment, make them feel a lot better and discharge them with some kind of... And you feel like you've kind of achieved something with your day. Is this toe okay?
No.
It's just that one spot.
Yeah. Yeah, there is some needle, maybe.
Yeah. Well, I think what we should probably do is pop a little dressing on there to give it a bit of padding.
Yeah.
And the little dressing, if there is something very fine, it will just help to draw it out. Okay?
Okay.
So we'll pop something on there to make it more comfortable. I'm just going to organise you to have the X-ray first.
Yeah.
Okay?
Okay.
Fantastic.
Yeah.
I think a lot of people go into nursing, it's usually because something's happened to them when they're younger. When I was 8, that's when my mum died. She died of cancer when I was 8. And anything I can do, I mean, even if it's a small bit you can do to stop anyone else having to go through that kind of terrible kind of emotion of losing someone, then you should probably do it. So, yeah, that's why I wanted to be a nurse. Ooh. You okay, Mr. Mirza?
Yeah. Are you Miss or Mrs.?
Miss. I'm a miss.
You are not married?
Not married, no. Husbands are too much trouble.
Oh, hi, it's Sarah Krish from A&E Consultants. OK, so we've got a 38-year-old gentleman. He's fallen 25 feet off a ladder. He's a tree surgeon. He banged his head on the concrete pole on the way down. He's got a large occipital wound, but his main injury is an unstable L1 fracture. And looks like the spinal cord is at risk.
Doctors are arranging for Paul to go to theatre for surgery on his back.
So is it still 7 out of 10 with the 5 milligrams of morphine I've just given you?
His pain threshold's usually pretty high as well, isn't it? Don't move. Do you know what? Because if you've got some damage, you don't want to make it long-term damage. You know, just keep as still as possible. Your back's such a funny thing. He used to drive diggers. It's quite a stressful job, and he thought, well, I'm quite good at at creating things, at making things. I'm going to give it a go on my own, have my own business. And first of all, he started off doing small trees, and then as his confidence grew, he started doing bigger and bigger trees. He just wanted really to be able to work less hours and spend more time with his family. Mr. Big Tuffy, yeah?
Let me guess. I think you look like a girl that would like pizza.
I like ice lolly and ice cream.
Have you had the ice cream where you have the bubble gum at the bottom? A screwball. My son, he loves that. Have you ever had a fall and hurt your knees, or...? No? Have you ever needed a plaster? Where? On your legs. That's a bit like your dad. He's just had a fall.
Off a tree?
Yeah, and he'll be better soon.
I love you, babe. It's horrible to see somebody that you look upon as being big and strong and seeing them reduced to, you know, just going insane with the amount of pain they're in. I just felt pretty helpless, but all I could do was hold his hand.
They're just waiting for the neurosurgeons to come down now, and then we'll know if they're going to do any intervention.
Hi. She good?
Abby's all right.
You stay with him a second, I'm just going to go and see Abby, OK? Just going to pop and see Abby quick, Fizz.
I think it's just a bit of a shock, isn't it, seeing her dad like that? I like the way you smiled. You thought you were quite happy. Well, not happy, but you wasn't worried. People look at me, and because of my age, I think they assume that I've been nursing for most of my life. But no, it's only been the last couple of years.
I didn't know what was going on. I was took out of class.
Yeah.
It said my mum's come and pick me up.
OK.
And she came and told me.
Oh. Yeah, I was a lorry driver and a bus driver, and then a pub manager, and now I'm a nurse. But you know your dad's tough.
Yeah.
I had a son that was involved in a car accident. I lost him. And so instead of curling up and going into a little ball, I decided to get myself off to college, get an education and put myself into that. And then I always wanted to be an A&E nurse. And I like to help others that are going through what I went through. That's what I like doing. That's how I help myself.
Hello, St George's A&E. A medical or trauma? A male or female? Male. Thank you. Adult trauma call, 12 minutes.
66-year-old fall 15 steps.
Just abdomen pain, chest pain with a hematoma to the back of the head.
He's come quite a long way, hasn't he?
We'll put a full call out. Adult trauma call, A&E resus.
Adult trauma call for casualty.
We're going into 4.
Adult trauma call for casualty resus.
Yeah, we will order a pelvis and a chest on this man. He is booked in as unknown. I will request that now. I think this is probably them just coming off now. Yeah.
Oh, here we go. This way.
Hello, guys. Good. Straps are clear all the way down. And just make sure nicely in the middle.
Anthony, 66-year-old, he was at the top of the stairs, which is roughly 15, 17 stairs. He fell down these stairs. He basically hurt his top of his left shoulder, left side chest wall, and the left side of the abdomen.
What else is it? Asthma and...
Asthma, prostate cancer and Parkinson's.
Don't move. Just let us move you.
So those can just lie down at the side there. Anybody coming with him? Wife's with.
I don't think there was anything different. All I can remember is that he was going downstairs. Obviously, he wasn't sleeping, so he was going to go down and make a cup of coffee or something. And then next minute, there was just a crash and a thump and another thump.
Yeah, a bit more.
Right, just here. Just sore in the tummy. No blood, no bruising. He's come a long way down. He's got a bang on his head.
That's when, you know, I just ran down.
And then chest and abdomen, so which...
The scary part was when he was laying there, his eyes were just fixed like that. And I really thought he'd gone, because his eyes were not moving.
His chest and his pelvis, his blood's going to go. We're going to pan scan him. Everybody's got lead on, haven't they? Because that's what we do for trauma calls. Ready?
Keep your arm across on your side, sir.
Scans are being organised. I'm going to speak to the wife to see if there's anything else. Got a bang on his head. He looks frail, doesn't he? He looks like somebody who's going to break. Should we get ready to go?
He's naughty, isn't he?
I've got really bad foot. Yeah, proper. Yeah, so much.
Do you have bunions as well?
Excuse me, hello. Don't have to tell the whole world.
Look. Have you got fake tan on, Jackie?
No. She's always got brown feet like that.
I don't wear socks in the winter.
What's that? Are you scared? What is it? It's a lion. Monkey. Daddy. 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 Is Daddy a monkey? Hi. Hi, Paul. Paul, what we need to do is, you've got a large wound at the back of your head, and the CT scan has showed that you've got some material inside the wound. What we need to do is give it a good clean out, and then either use stitches or staples to close it, depending on how it looks.
Doesn't need the oxygen now.
No, we're going to take this off because your neck's actually all right. I'm going to see if I can get to the wound without having to turn your body. So we just move your neck, OK? Because I think that would be less painful for you.
How's your pain relief? How's your pain now?
A bit more pain, yeah.
A bit more pain, that's good.
OK. Just put your head down.
Doctors must treat Paul's head wound before he can be taken to theatre.
Hi, honey. It's a bit of a shock for you, isn't it?
So, Paul, instead of stitches, we're going to use a staple gun. OK, it's just as effective.
He started off as sort of a wild teenager. The area and the time where we grew up, it was very much a case of survival. It was quite a poor area, I suppose, where he was, and there was a lot of single parents. Kids were sort of sent out in the daytime to fend for themselves, and he grew up really quite fast, I think.
That's it. OK.
We're done?
Yeah, that's fine.
He's the kind of husband that likes you to feel safe and wants to look after you.
I'm going to now make you look beautiful for your daughter.
Oh, thank you.
That's all right. I'm going to do my best not to make you look silly.
Like Rambo.
I don't know. I'm going to do my best. I'm not very good at this, especially when someone's laying down and you can't move them.
You have to dig very deep to get to the inside, I think. He's obviously soft, really, at heart, but you've got so many layers to get through. He's had things in his life that have made him like that, but he probably thinks he's tough on the inside and tough on the outside as well.
That should be fine. How does that feel?
Yeah.
It's a nice little hat I made you.
Thank you.
No worries.
Me again.
Yeah.
I can't see anything on the X-ray, like any kind of foreign body in the toe. Can we get you up onto the bed?
Yeah, why not?
We'll just put a little dressing on to protect it. I'll put that there.
Yeah. Woman needs to look, but your hair is not showing. You are.
My hair?
Yeah.
It's quite long.
No, it is not long.
It's not long.
No, it is not shining.
It's not shining. Oh dear.
Yeah.
Sounds like I've got a few things I need to work on. Maybe this is why I'm single, Mr. Beza.
No. You are not caring.
No, not married, not with anyone. No children. Yeah, just me.
Very nice.
Okay. I'm quite happy doing my thing, but I'd love to share it with somebody. Oh, this is the way. This way. Thank you. This way, look. This way.
This way?
Yeah, this way.
This way.
You just want someone to kind of just share your journey with, don't you? Bye. That's all anyone wants. When you can give your everything to someone and you don't need anything in return, but you say you don't need anything in return, but you know that they would do the same for you. It's just I don't think you can explain it. It's just that feeling, that knowing that you have someone or something there that's always gonna kind of protect you and want the best for you, really.
I met him through a dating agency. It was 1975.
Right, you keep your arms down by your side for the moment, okay?
They sort of matched you up with what information you put down, what your age and, you know, what your personality and everything is. And then they just sort of match it up with someone else. I mean, obviously he applied as well. So that's why they did it then. Centuries ago.
Good man. You're doing really well.
I remember we went up in London somewhere, and he had this funny coat on then, which was it was like a tweed coat, but it was an overcoat thing, but it came down a bit long in the length then. This is going back 1975, so, and sort of a belt round the middle, and I thought, I don't like that. I don't know what happened to the coat, but he's lovely. I think it was about February, and we got married 1st of November. It's like my soulmate, really.
Retired catering manager Anthony is in resus after falling down 15 stairs at his home.
Anthony, we're just waiting for the full results of the scans. I've had a look. You've broken a few ribs. All right. And on this side, on your right side, one of the ribs has probably just punctured your lung a little bit, and it's collapsed a little bit, the lung on one side. OK? We'll need to put a little, we call it a drain, a chest drain, a little drain into your chest to let that air out and get you better sooner, OK? I'm going to give you some very strong painkillers that just makes you go away with the fairies a little bit. Yeah?
You can do that.
Would you be happy to going away with the fairies for a little bit?
Oh, yeah.
Yeah, good. They'll be nice fairies. They'll look after you. Yeah. I'll take you back down to the back down to that room there, and we'll come and get you as soon as we are sorted out. All right.
Sharp scratch, just a bit of anaesthetic.
2009, I was diagnosed with prostate cancer. A bit of a blow.
You can relax. I've got your arm, so it's not going to go anywhere. How long ago did you retire, Anthony?
18 months.
18 months. Did you find it easy?
Very.
Good man. Very good.
And 13 months ago, I was diagnosed with Parkinson's. So not a good couple of years, to be honest.
Yeah, I think so.
You all right? OK.
Sorry. Well done, Anthony.
Doing well.
It's almost done.
When I think health-wise, what he's been going through for the last quite a few years, and, you know, he's still carried on working. I mean, obviously you have to, but, you know, he never complains about anything like that. He never complains about, you know, not being well or anything. He just gets on with it.
You're doing well, OK?
It's all done, and we're just going to sew it in now.
Chest drains on the side.
We had a few holidays earlier on before we had the kids, or even when we had the kids. I prefer to go out for a day or something. This is about the first year that we haven't gone to Hampton Court, because we usually go across the bridge and walk through, and you know, got all the beautiful trees and the deer and things like that. But we haven't even done that sort of in the last couple of years because, you know, of his sort of health.
You all right? What's up? You all right? Just wanted to hold my hand. I won't tell anyone. I won't tell the wife.
I said to him, you don't realise how much I love you. And he said, I can't think why. See, straight away, he's thinking of things that he's got wrong, you know. But that shouldn't matter, should it? It shouldn't matter what he's got wrong with him. But that is one of the things that I do sort of fret over, because as I say, I don't know the outcome of all this. So.
Stop worrying about money, Fizz. Put money in your bank account. I know it's towards a car, but how? Life gets in the way, doesn't it? We'll cope.
Tree surgeon Paul has been in resus for almost 4 hours.
There you go. You're going to have to stand your back, I'm afraid.
He'll be taken to theatre for surgery on his back. Only then will doctors know whether he'll make a full recovery.
He was the provider, the person that went out and brought home the money and made sure everybody had what they wanted. The whole atmosphere in the house has changed because he's the presence, he's the one in charge, and it's almost like the person had disappeared even though he hadn't. You just got to carry on as normal as possible for him, because if he feels that the family aren't the same, then he's going to feel even worse. Do you want me to lift you up so you can see Daddy properly? Come in. Yeah, that's it. It's on the way, isn't it? It's like Mr. Bump, doesn't he? Yeah?
Or does he look like he's got an eggshell on his head?
Eggshell.
Yeah, we call him Egghead.
Yay!
I think the thing about working in A&E is a lot of really horrible things happen to really good people, and people wake up in their normal day and then suddenly things happen that change their life completely and change their families' lives completely, and it just makes you really lucky and grateful for what you have.
What have I learned from life in A&E? Don't take it for granted. Spend as much time as you can with your loved ones. Tell them that you love them. What are you going to do when you get a big girl? You're going to be a tree surgeon?
Marry a millionaire and be a kept woman.
Because we don't know how long we've got. We don't know what's around the corner. That's what I've learned.
Yeah.
A nurse? No, you want to be a policeman. They earn more money.
You got a brave boy.
Has he been brave?
Yeah.
I mean, if you have an accident, you don't know it's going to happen, do you? But with what he's got, you're thinking about it all the time.
You did really, really well there. Yeah.
Come around that side there.
I said payback time because you're always winding me up. You know, I mean, that's that at the moment we can have a laugh. We have sort of, you know, he answers me back and then I answer him back and I say to him, I'm going to win this one, you know. And that's the sort of way we are. You hot, darling?
Yeah.
Yeah, do you want me to take these off a little bit? Because you've got... All right. Sometimes I get sort of a bit... I don't let him see it, but I get a bit sort of choked because what he could turn into, I don't know, with this illness, you know, can not being the same person. What are you trying to do? What are you trying to do?
Yeah.
You can't get out, lovey. You just got to accept what's happened, all right? I hate being on my own. It sort of scares me. I don't like it. It's too quiet. But no, I don't want to think down those lines. Little thing, aren't you? Fancy chucking yourself down the stairs. No, you don't. You just took the wrong corner, darling. That's what I'm saying. That's why you've got to be very careful. This Parkinson stuff.
We already can see the air coming out of your chest wall, so your lungs will start inflating up. It'll make your breathing and things better, and especially you with your bit of lung disease, it's important that we get that in.
What does Jennifer mean to you?
It's my rock. It's my rock.
You okay? Just a bit of a shock. You'll be all right. All right?
I wouldn't have anything different, I don't think. Not really.
Dream nice things. In fact, I'm quite enjoying looking after him. That sounds awful, doesn't it? He's there for me all the time, you know, and now it's my turn to look after him. Go to sleep.
You feel like you can just deal with anything that life throws at you now?
I can't throw much more at me. Been through quite a lot, really. Yeah, I'd do with anything now. It just sort of like opens your eyes to you ain't invincible, do you know what I mean? Next step for me is get well enough so I can work 5 days a week at least and just get back to normal. You know what I mean? That's what I want to do, get back to where I was.
you.